At the Heart and Vascular Center of Excellence at Memorial Hospital, a special group of talented surgeons and physicians have come together to provide our patients with access to exceptional cardiac and vascular care. The goal? Better outcomes through collaboration. With a focus on coordination of care, the Heart and Vascular Center of Excellence team can meet your heart and vascular healthcare needs at one convenient location. With cardiology, cardiac surgery, interventional cardiology, vascular surgery, the heart failure clinic, and cardiac rehab all on site, we have your care covered.
In our group itself, we provide pretty much all the care that's needed from a cardiac standpoint. We have invasive cardiologists, interventional cardiologists, we also have an electrophysiologist, so we kind of can provide full service for what the patients need. In conjunction, we work with the hospital that has many of the services that we require, and they do provide great care, including cardiac rehab and things of that sort. If we need surgery or a cath lab, we need access to do procedures, we have do all of our procedures here at Memorial Hospital. So it's a collaborative effort between our group and the hospital working together along with the primary care physician to try to take care of that patient.
Together, our team can perform everything from EKGs and carotid ultrasounds to open heart surgery and stent placement. Using the latest technologies to perform life-saving procedures, the Heart and Vascular Center offers complete cardiac care right here in Belleville. Plus, Memorial Hospital is an accredited chest pain center. Whether surgery is required or not, a heart condition can be a frightening ordeal. But Patrick Murphy felt completely at ease at the Heart and Vascular Center.
I came to the Heart and Vascular Center. I was developing some chest pain and tingling in my arms, not knowing what was wrong. I was immediately diagnosed as in the process of having a heart attack. Within minutes, I was taken to the cardiac cath lab where their team of technologists and nursing staff greeted me and proceeded with the cardiac cath. It was very quick, it seemed like fast. Everything was explained to me. I proceeded through the process. Dr. Mahmood was my cardiologist, explained everything to me, showed me on the monitor, gave me some options of what could happen. As the process went on, we went in and put some stents in and showed me where the stents were and said that, you know, the prognosis was good. There was some rehab involved, kind of led me to what was going to happen next, and it was very uneventful.
Communication between patients and providers is a priority from the first moment a patient comes to Memorial for a cardiac or vascular issue.
Well, we talk to them about lifestyle modifications, controlling their blood pressure, their cholesterol, if they smoke, trying to help them quit smoking, start an exercise program. We try to just help them do the things they need to do to slow the progression of this disease. I mean, it's the #1 killer in the United States, by far.
For many patients, cardiac rehab is a key aspect to recovery. Nancy Rakowski came to the Heart and Vascular Center after experiencing a squeezing sensation in her neck. The main artery of her heart was 96% blocked. After surgery, she knew something had to change.
I went to cardiac rehab. Those people there are absolutely wonderful. I learned quite a bit. I exercise now, mostly 5 days a week, and that is due to cardiac rehab because I don't think I would have done it. They had a nutritionist. I talked to nutritionists. They helped me also change I don't ever call it a diet, I call it a life change because I just changed what I was doing. I don't watch what I eat, I do smaller portions, and I learned that from here because I don't think I would have changed had I not had all these things afterwards. I still am in contact with cardiac rehab, the people there. I do the heart walk with them every year. I couldn't say enough about this hospital. I think they're caring. They generally care. I mean, you can get a caring place, but they generally care about you.
In addition to cardiac rehab, the Heart and Vascular Center also offers the Heart Failure Clinic. Its entire team is committed to helping heart failure patients improve their quality of life through education and encouragement.
You don't get this service anywhere else that I know of, this intensive service in this area, because what happens is we have a dietitian, we have a pharmacist, we have a nurse practitioner, and a nurse. You have 4 healthcare providers just taking care of you. We usually only schedule 1 patient at a time, and initial visits are a couple hours long. So you don't get that service anywhere else in this area, that you're having 4 healthcare people take care of you.
Because cardiac and vascular disease patients are often referred by family or internal medicine physicians, the Heart and Vascular Center team will stay in close contact with your provider. And when further referrals are needed, it's nice to have a team of providers in one location. From that single location, the Heart and Vascular Center brings quality care to cardiac and vascular patients for one reason.
Well, I mean, essentially I want them to feel better. You know, somebody comes in with a problem, whether it be life-threatening or not, my goal as a physician is to make them feel better, to make their quality of life something that they feel good about. And that to me is the biggest outcome effect that that keeps me coming back for more, is that these people really do feel better and let you know that.
This is something the Heart and Vascular Center patients also know to be true.
The bottom line of what they try to do here is try to give us a better quality of life. And I think that's one of their main goals, is to have for us to have a better quality of life. They never make you seem like you're not as important as the next person.